Allergic conjunctivitis and dry eye disease are highly variable and two most common ocular surface inflammatory disorders. These disorders have been regarded as the epidemics of the 21st century, affecting the quality of life of people. Results of quality of life studies have shown that the impact of moderate to severe dry eye can be similar to that of moderate to severe angina. Now, why this study? Dry eye hinders the removal of allergenic antigens on the ocular surface, which exacerbates allergic conjunctivitis. Similarly, allergic conjunctivitis has been shown to disrupt the tear film stability, contributing to worse outcomes in patients with dry eye. These negative interactions between the two diseases necessitate bidirectional diagnosis and management to prevent chronic damage to the ocular surface. My aims and objectives were to study the prevalence of dry eye in clinically diagnosed patients of allergic conjunctivitis, to study the prevalence of Meibomian gland dysfunction in patients of allergic conjunctivitis. Materials and methods, it was an observational cross-sectional study which was conducted from June to July 2023. 32 patients having the chief complaints of itchiness and redness in the eyes were included in the study after taking proper written informed consent. In pediatric patients, consent was taken from the parents or guardian. My inclusion criteria was clinically diagnosed cases of allergic conjunctivitis having the chief complaints of itching and redness aged from 7 to 60 years. And exclusion criteria was patients on any topical medication, history of contact lens wear, history of refractive surgery or any other ocular surgery, history of ocular trauma, corneal pathology, systemic diseases like diabetes, collagen vascular disease, hypertension, and on medications like immunosuppressants and isotretinoin. My methods of evaluation consisted of OSDI scores, Tremor 1 test, TF beauty, and slit lamp evaluation for Meibomian gland dysfunction. Now these were my results. The male to female ratio was 12 to 20. And we can see that females outnumbered the males. The perennial allergic conjunctivitis was found in 28.12% of patients, seasonal allergic conjunctivitis in 53.12%, and VKC in 18.75%. According to the OSDI scores, 18 patients had normal OSDI scores, 10 patients had mild dry eye, and 4 patients had moderate dry eye. The mean OSDS scores was found to be significantly higher in patients of perennial allergic conjunctivitis, which was 20.33 plus or minus 7.22 standard deviation, and the p-value was found to be statistically significant, that is less than 0.001. According to TF beauty, 8 patients with dry eye having a TF beauty of less than 10 seconds, which included 4 patients of perennial allergic conjunctivitis, 3 patients of seasonal, and 1 patient of VKC. And according to the Shermer 1 test, 10 patients with dry eye having a value of less than 10 millimeter in 5 minutes, which included 5 patients of perennial, 4 of seasonal, and 1 of VKC. Now coming to Meibomian gland dysfunction, out of the 32 patients that we had taken, 11 had associated Meibomian gland dysfunction, which included 7 of perennial allergic conjunctivitis alone. And of these, 4 patients had grade 1 dysfunction, 5 had grade 2, and 2 patients had grade 3. Now my outcome was allergic conjunctivitis was found to be more common in females, of which seasonal allergic conjunctivitis was more common. Perennial allergic conjunctivitis has a higher prevalence of dry eye, followed by seasonal and then VKC. And in our study, out of the 32 patients, 10 had mild dry eye disease, 4 moderate, based on the OSDI scores. Meibomian gland dysfunction was significantly found in the perennial allergic conjunctivitis patients, that is 77.8%, indicating its association with the chronicity of the disease. The limitations of my study were, it was a cross-sectional study, not longitudinal, had a small sample size, duration of the study was small, and meibography was not done. Coming to the discussion part, TFOS-DWS2 has identified allergic conjunctivitis as a probable risk factor for dry eye disease. Similar findings have been found in other studies of seasonal allergic conjunctivitis being the most common. Mazumdar et al. Had a similar inference of perennial allergic conjunctivitis having a higher prevalence of dry eye. Prevalence of dry eye in our study differed from other studies, and this decrease in prevalence could be due to climatic variations as our region had high humidity. Conclusion. Ocular allergy contributes to tear film hyperosmolarity, ocular surface inflammation and damage, all of which are key mechanisms in the vicious cycle of dry eye disease. Meibomian gland dysfunction is a major long-term complication of allergic conjunctivitis. The inflammation response, continuous mechanical stress induced by chronic eye rubbing in allergic conjunctivitis are presumed to be associated with the onset of Meibomian gland dysfunction. Therefore, allergic conjunctivitis patients need to be screened for dry eye disease even after the resolution of symptoms, and associated Meibomian gland dysfunction needs to be treated in order to improve their quality of life. Thank you, everyone.